ADHD 911 call center. What's your emergency? If you're watching this video, you wish that a call center like this actually existed so that you can know what to do because nothing's working at school. If you want answers, keep watching. I'd like to welcome you to the first of a two-part series on ADHD 911, common emergencies and what to do. In this episode, we're talking about medications that are no longer working. Here you are. This is you. You dropped your beautiful kids off at school. You packed them in the Toyota Sienna. You hammered it to school. You slid into the parking lot, right? Into your Toyota Sienna. And you slid, and as you slid, you pushed the button, and the door to the side opened, and your children, okay, and all of the smashed sunscreen and old French fries, all of it flew out, right? And it like splashed onto a substitute teacher. And like your children, you unbuckled the seatbelts, and they rocketed from your car into their classroom, landed perfectly in their seats. You push the button again, beep, car door goes shut, you hammer it, smoking, roasting those wheels, flying out of that parking lot. You are on your way to Starbucks to sit down to have the first 15 minutes of peace over the last 3 months, okay? You wave goodbye to your beautiful children, and all of a sudden, ring-a-ling-ling-a-ling-ding-dingy, you get a call. You get a call, and guess who it is on the phone? You know who it is? It's the school. It's the school, and they say, Johnny's out of his seat. Johnny's not listening. John's not paying attention. And you say, oh, don't worry about it. No big deal. We put Johnny on the medicine. And they say, did he take the medicine? That's the episode we're talking about today. So they're back in school, and Johnny's there, and you had high hopes, right? He's on the medicine. It worked okay last year. Maybe he took a break over the summer. He's fallen asleep at the abacus. Everything is hilarious. Look at this guy. He's laughing his face off. You're thinking, this is going to be great. Nope. Turns out this causes problems in a school system. So let's talk about what you're going to do about it. The goals of our time today are going to be very simple. We're going to talk about common problems with ADHD medicines and common strategies to deal with these problems. All right. Number one, the first of a two-part series is medications are no longer effective. So what do we do? What do we do? Okay, what is this, magic? Was some kind of magic happen? Right? They were working fine 3 months ago. They were working fine 3 minutes ago. But all of a sudden we're in school and some kind of pharmacologic magic happens and nothing's working and Johnny's laughing his face off all day out of his seat, not learning nothing. Sitting at the abacus being like, wish I was at the pool. What do? Listen, the first thing I want you to understand when you think about medications that are no longer effective is that there's 4 primary reasons why this is. Let's talk about our number one. Number one, okay? Maybe the problem is the school. Maybe the problem's not actually the medicine. Maybe the problem is school. Okay, now I like this for a lot of reasons because those are external knobs that you can turn. Those are external buttons that you can push that don't have to do with manipulating the neurochemistry of your child's brain. Maybe the problem is the school. What do I mean? Maybe the classroom's out of control. Now look, I'm not trying to blame anybody. I'm not trying to blame teachers. I love teachers. I'm a huge fan of teachers, okay? But maybe the classroom's just out of control. Maybe there's unclear expectations in the classroom or they're in the process of setting those expectations. Maybe it's a poor fit with either the peers in the class or the teacher, or maybe there's unmet academic needs. Maybe your child needs more supports. Maybe a 504, maybe an IEP, maybe a one-on-one, maybe some pull-out supports to work on areas of weakness. My point is that whenever a child struggles in school, it doesn't necessarily mean that the medications are broken. It could mean that an external environmental factor has shifted, and that sometimes we need to think about that. If your medications for your child have stopped working, maybe it's the school. Okay. Now, but let's say you think you know what, you're like, Noble, yes, you know what, Noble, you're right, you know some stuff. Maybe it is the school. I'm going to advocate for an IEP or a 504 evaluation. How does that work? You go to the school and you say, things aren't working great, okay? I know that you guys are calling me, and I'm at Starbucks, and I'm trying to enjoy a mocha strata latte, and you guys are calling me because Johnny's out of control, and you're saying things like, did he take his medicine? And I said, yes, he did take his medicine, and we're doing our best, okay? We're pulling all the knobs, we're pushing down all the buttons, we're doing the best we can to optimize medications, okay? But maybe Johnny needs some extra support at school. Can we have an evaluation to see if Johnny could qualify for an IEP or a 504? Now, if you don't know what those things are and you want to know more about it, I'll link another video I've done above to help you understand what those are and what the difference is. are, okay? If you have an IEP or a 504 and you have some specific advice to share with us, please drop those comments and we can learn from each other. Maybe you can advocate for an IEP or a 504. Maybe you could meet with the teacher and just clarify. You would be surprised how far this goes when you're advocating for a child in a public classroom setting. Listen, I understand my child's not perfect. We got some stuff. We're doing our best, okay? We're going to try and meet with the doctor. We're going to try and do our part, but I just want you to know that we're aware of this and that, please tell me what we can do. I'm on your team. Let's work together to try and help this child be successful, okay? So maybe it's the school. All right, so maybe it's not the school. Maybe we've done all these things. Maybe you're doing these things. The academic environment has been optimized. Maybe it's the meds. Maybe it's the medications. How can you even begin to figure out if that's possibly the answer? Well, first and foremost, there's no side effects. Okay, what do I mean? Well, again, I'll link another video up here. Medications for ADHD, typically stimulant medications. Okay, check it out. Go check this out. Typically, stimulant medications have side effects. Okay, I'm going to say something. I don't want you to get mad at me. Medications that have effects often have side effects. Okay? If there's no effects and there's no side effects, we call that a Tic Tac or a vitamin. Now, would I rather have kids taking Tic Tacs and vitamins? 100% I would, okay? I don't want medicines for kids if we can avoid it. We only treat impairment, right? Kids whose lives are a real disaster because of their behaviors, their inability to focus and attend to tasks. But if we're going to use a medicine for ADHD, it's going to have effects and it's going to have side effects. And what are those side effects? Well, they're eating fine. They don't eat well. They struggle to transition off the medication in the evening, so they get more irritable or less focused. Sometimes they struggle with sleep onset difficulty. Sometimes they can become just more easily frustrated. Okay, these are side effects. Okay, if you come to me with a medication that's not working, okay, the medication's not working, and I ask you about side effects, and you're like, nope, doesn't seem to have any side effects. Nope, doesn't have any. It's like a Tic Tac. Then that's a medicine that's likely not working because the dose needs to be adjusted, right? Maybe it's the medications because it stopped working last year. Like if you look back, right, you think back like, well, actually in the end of third grade, things were kind of falling apart. But then we took them off the medicine and we went to Disney World 50 times and we played at a bunch of playgrounds and swam in some public pools, and that was, things seemed to be okay. Yes, because those are all low structure environments where nobody's sitting and listening, right? So you maybe gave them a drug holiday and you have to think back, oh yeah, I guess things probably weren't working well at the end of last year, right? The child's gaining weight, right? Maybe they've gained a ton of weight over the summer. You have a different kid. These medications are not strictly weight-based, but sometimes when a child gains a bunch of weight, the dose needs to kind of reflect that by being optimized. Sometimes the dose is really, really low. Sometimes the child just, comes off over the summer, as we've said. Sometimes there's no stated benefit at all. Like I'll ask the child, I'll literally say, hey, look, man, when you take this medicine, what happens in your brain? Tell me about what your brain does. Do you feel like your brain is able to really work hard? Do you feel like your brain is able to pay attention? Do you feel like you're really able to get the work done? Right? Because if there's no stated benefit, right, then it's likely that medication's not effective. Or, and this is one of my favorite ones, if you don't know if this medication is effective, if you're not sure if the medication is actually useful for your beautiful cherub child, skip a dose. Now, maybe you've done that a bunch and this is not you, but for a lot of people, they never skip a dose, right? They follow the rules or the perceived rules, and they never skip a dose, and I say, okay, the medicine's working, no problem. Stop it. Stop the medicine. And people will be like, oh, we're nervous to do that. And I say, whoa. I love you. You're fantastic. You just told me for 20 minutes how this medication does not work. So quitting the medicine shouldn't really make that much difference. Stop the medicine, right? So sometimes I'll say to families, you ever skip a dose by accident? You ever skip a dose by accident? And some people will be like, yeah, we did one time, and it was nuts. He was totally different kid. I mean, there were some good things. He ate a lot, but he was totally out of control. And then I say, so maybe the medicine does have some perceived benefit then, right? Right? those are some of the tips that you can use to think about maybe if it's the medications or not. All right, how about this one? So if you know it's the medicines, right? You know it's the medicines and you're pretty comfortable after what we've discussed that you know what, I think the medicines are the culprit here, then you're going to either optimize the dose, change the dose, or change the medicine, okay? But when you come into the clinic, when you come into my clinic or your primary doctor's clinic and you have these kinds of concerns and you've isolated it to, you know what, I think it's actually the medicines, you're going to leave with a change in dose or a change in medicine. Why do I say that? Because listen, these medications, okay, I'm going to say this. Medications for ADHD are a lot like people who show up at a code in the hospital. A code. Now, codes are scary, right? Somebody is in crisis, all right? So you need to maintain the airway. You need to look at the cardiac rhythm. I mean, a lot of life-saving measures must be taken in a code. And what you need in a code are people doing stuff. You're a recorder, you're getting medications, you're activating 911, you're doing compressions, you're doing the airway, right? People are doing stuff. What you don't need in a code is a bunch of people standing around, okay? Medications that are just standing around. They're just standing around like, well, I know he's taking medicine, but it's not really doing anything noble. We don't allow that, okay? We either optimize the medicine to make it become effective, or we get rid of it and replace it with a medicine that will be effective. But please, please, please don't take a medicine just because somebody told you to, unless you can tell me why and how it works. Does it benefit your family? Yes or no? If the answer is no, change the dose or change that medicine. You feel it? You feeling me now? Okay, is it school? Maybe. I don't know. I gave you some things to think about. Maybe the medicine needs to be changed. Okay, yep, let's think about that, but we're not done. We got a couple more things to talk about, and then we're going to take a break, and we'll talk more in our next video about some of the other reasons why medications don't work and what you do, okay? Maybe it's the school, maybe it's the medications, or what about maybe it's the child? Uh-oh. I'm coming after Johnny Pumpleskins now. Maybe it's the child. Maybe you could increase the dose all you want. You can optimize things. You can manipulate things. You can change things. You can optimize the academic environment. But it just doesn't matter because the child has a problem. There's a reason why the child's unable to demonstrate the anticipated academic progress, and that's because they've got an issue, right? Maybe they're not sleeping. You'd be amazed. You're watching this, you're like, oh, this isn't me, Noble. You would be amazed. Okay, now in the YouTube realm, raise your hand if you think that allowing a child to fall asleep with a screen is a good idea. No one's watching. You're by yourself. Nobody's judging you, okay? Hopefully you're probably just listening to me in the car or whatever you're doing. But I'm telling you, raise one hand if this is you. Listen, life is hard. Okay, I get it. Life is hard, okay? It is. It's so hard. But allowing your child to be coddled to sleep with a screen is not worth it. Some kids don't sleep, and they're exhausted, right? And it's not just because of screens, right? It's because of other things. Sometimes it's because, they snore all night long. They wake up sweaty and scared. So they have like an obstructive sleep apnea, right? Or they have like a terrible anxiety, so they can't regulate their sleep because they're stressed and worried, right? Or they have a restless leg syndrome. There's reasons, but they just aren't sleeping well and they're exhausted. Sometimes a child has vision and hearing problems. Sometimes they got vision and hearing problems. I've seen it many, many times. They come in, people think they may have an autism spectrum disorder. People are concerned they maybe have a learning disorder or a learning disability or ADHD. And then it turns out they can't really hear well, or they can't really see well. And you're thinking, well, kids will know that. Kids will know that. They'll say that. Well, yeah, some kids will, but some kids won't. So just, you can't take these things for granted. You need to pay attention. Does your child potentially have a hearing or vision deficit that could be addressed? Constipation. Constipation's a big one. I mean, in the developmental clinic, in the genetics clinic, I see kids, everybody's constipated all the time, okay? And constipation is difficult, okay? Because it's hard to sit and listen when your GI tract wants to explode. When your GI tract wants to explode, when its preference is explosion, That's not a good feeling. And when is it worst? Well, let's talk about the gastrocolic reflex. 20 to 30 minutes after you eat, your gut says, we should probably move things through. We should move some stuff around here. This rascal's eating some cotton candy. We should get some stuff moving around here so we can make more room for, other things that might come down the pipe. So the gastrocolic reflex kicks in, and it gets really uncomfortable for kids, especially when they don't move their bowels more than once or twice a week, which, if you don't know, not normal. Move your bowels. How often should a kid move their bowels? Once or twice a day, no pain or blood, consistency of toothpaste. How can you possibly know that? Ask, do a stool diary, do something, pay attention, right? Stress. If you got a divorce in your family, if grandma lives in your house and she's on a hospice bed in the living room, yeah, that's stressful. There's a sibling who's really ill and in and out of the hospital. You're having to sell your house. These are stressful things. Sometimes kids just aren't going to do well at school, and there's no amount of optimizing medicines that's going to fix it. And lastly, sometimes they have a discernible learning disability. It doesn't matter how optimal the medications are. They have a learning difficulty that's not going to be fixed by optimizing their ability to attend to task. They need additional accommodations. So what do you do about all these things? Well, sleep hygiene's key, right? Take those screens away at least 2 hours before bed. At least 2 hours before bed. They don't need that stuff, right? Get an evaluation with your primary care provider. Remember, some of these things are medical. It's not just ADHD period. Sometimes it's ADHD ... Take a stool diary. Do the best you can to get a sense as to whether or not your child has a healthy gut pattern and is moving their bowels daily. Maybe a psychological evaluation. Maybe your child needs to have a more formal evaluation to assess whether or not there's a learning difficulty. All right, let's keep going. All right, and then lastly for today, maybe the problem is you. Now, I know this is not a great way to end our time today, but this is not the end. This is the first of a 2-part series. I'm going to put out the next one next week where we're going to talk about some other things, but maybe can we just end here with a little bit of self-reflection? Maybe the problem is you. All right, you have unrealistic expectations. Johnny's 5, he's 6, he's 7, okay? You have an unrealistic expectation. You have an unrealistic schedule, okay? You're running like crazy. You're going to soccer games and soccer practices and things like this, and you're just convinced that Juilliard and Harvard are coming next year. He's 6, okay? He's still trying to work out the tooth fairy, all right? So maybe, just maybe, we need to give Johnny a break, all right? So what do I mean? What's some tangible takes home? Don't compare, all right? Every kid is different. Now, are 5-year-olds similar in a lot of ways? Yeah. Are they different in a lot of ways? Yes. There is no reality, okay? There is no reality where your child is going to be like your neighbor's kids or your nieces and nephews, right? Your nieces and nephews are going to be super great on some things, and they sit and they listen and they're super kind. They're not, taking their pants off or starting fires in the garage. And that's fine. Okay, good for them. Good for them. That's not your kids, and that's okay because your kids have strengths too. Listen, there's 2 kinds of children in general in this world. 2 kinds, okay? There's the kind who work at companies. You drop 99 toothpicks on the ground and you say pick up 74 of them. They pick up 74. They just leave the other ones. They don't ask any questions. They just do what they're told, and they're great employees, right? Those are going to be great people to have at a company working, okay? But there's 2 kinds of kids. There's the kinds who work at companies, okay? And there's the kinds that start companies. And if you got a kid who's hard to control, doesn't want to follow the rules, sees a sign that says don't walk on the grass, and they say, why? I'll walk on the grass. What's going to happen? They're going to arrest me? That's probably somebody who's going to start a company. Okay? So please remember that just because your child struggles in the moment doesn't mean that the rest of their life is going to be a struggle. Don't compare, all right? Don't compare. Don't over-therapize them. Please, please, please listen to me, okay? I don't want your kid to be involved in tutoring 5 days a week. I don't want them to go on PTOT and speech 3 days a week. Are those important things for some kids? Yes. Yes. But I also want them to go on bike rides. And I also want them to go on merry-go-rounds. And I want them to, figure out how fishing works. I don't know. I just want them to do stuff. I want them to be a kid. I got 4 kids and I don't have much time left with them, and I'm reminded every day that I don't want you to spend your child's most important seasons of life while you're in a waiting room updating yourself on Facebook while they're being therapized by somebody. There are people who need those kinds of services, but I want you to ask yourself, is your child really one of them? Maybe, maybe, maybe not. Okay, bet on the child. Bet on the child. Listen, if your child doesn't get it this year, you can assume that maybe they're just going to get it next year, right? A lot of these skills are what we call developmental skills, meaning you're going to get it eventually. Eventually, you're going to figure it out. So just give the kid some time, back off. Harvard doesn't start next year, okay? Take some breaths. It's okay if Johnny's not the best reader in class. It's fine if he's not in the aqua reading group. It's okay if he has some pull-out supports for Title I reading. That's fine. That is totally fine. But let's just give him some time to breathe and let the process work. Let those neurons mature and let him come to the right conclusion about his own skill and aptitude. And lastly, please, please, please be mindful. Be mindful of the message that you send your child. If your child gets the message and that all you care about is their ability to perform, their ability to sit and listen and comply, those are important things. You want them to be respectful. You want them to do the best they can, but that's not the only metric that matters. It's not the only metric that matters, okay? There's other things to think about. So when you do talk about these things, you just want to emphasize, look, are you doing the best you can? Are you asking for help when you need it? Are you being a good friend? Because when you go into classrooms, oftentimes they want to talk to you about metrics and rubrics and things like that. But you want to know the only rubric that matters in a 5, 6, 7-year-old kid, if you want my honest opinion, okay? You want my honest opinion? All I want to know is, are they respectful? Are they compliant to the best of their ability? Are they a good friend? Are they a good friend? Those are the rubrics that matter most, because that's what the roots of a person who grows up to be a good person looks like. A kind person. Yeah, you can be opinionated. Yeah, you can disagree. But in general, do you have the basic foundational skills to know how to be a decent human being, right? That's what we want, okay? Now, in the next videos, next week, we're going to be talking about what happens when the medications wear off too early, because that's the other set of problems. Maybe the medications are wearing off too early, and you need to talk about we need to talk about what it is we're going to do about that specific problem. Okay, now listen. Please understand that these videos are not meant to inspire us to be perfect parents. You've got it in your mind what parenting is like and what it should be and how you should be as a parent, and the likelihood you got that from a book or a sitcom or a dysfunctional family is pretty high. It's pretty high, okay? Please understand that no one is asking you to be a perfect parent, but what we do need to be, and we do need to endeavor to become, are better parents. And the only way that we can do that effectively is together. We are better together. Thank you for watching. Stay tuned next week as we finish up this conversation. Like and subscribe and get out there and get after it.